Welcome to Good Health Matters, where I'll be exploring ways that we can become healthier versions of ourselves. Today I'm talking with Dr. Ann Jacobson, who is a family physician who has spent years caring for patients at one of the largest safety net healthcare systems in the US. Today we'll be discussing why primary care matters, how you can get the most out of your doctor's visits, and the health habits that can make a difference. Thanks for joining me, Dr. Jacobson. If you don't mind telling me a little bit about your story and how you got into medicine, that would be great.
Well, thank you for having me today. I'm excited to talk with you. So my name is Ann Jacobson. I live in Oak Park, Illinois, which is just outside of Chicago. I wasn't one of those kids who kind of grew up always knowing that I was going to be a doctor. I grew up in a very small town, a farming community. Both of my parents were high school teachers and were actually the first in their families to go to college. And I was always into stories and writing, and I thought I might be an English teacher or possibly a journalist or a writer. And then it was really, I think it must have been like the summer before my senior year when I was, you kind of get that torrent of college mail, and I was going through all of this college mail, and I kind of kept seeing pre-med, and it sort of hit me just like a ton of bricks. You could do this. You could be a doctor. I didn't know anyone who was a physician, but I decided to pursue it. In college, I did all of the pre-med courses, and I was a psychology major because I was always interested in the human brain and emotions and how all of that fit together with our lives. So I was pre-med in psychology. I did some volunteer work during college that kind of gave me a little bit more experience. And then between college and medical school, I took a gap year, which now that's pretty common. Most people take a gap year or 2 or 3. At the time it was pretty unusual, but I got accepted into medical school and decided to defer a year because I wanted to take a year just to do something else and kind of get my hands dirty a little bit. So I did a full-time volunteer program. I was in Atlanta, actually, not too far from where you are, I think. Did social service for a year, and that kind of really solidified my decision to work in underserved medicine and to kind of work with populations who might not necessarily have access to healthcare or access to the best healthcare. So that was kind of my journey into medicine. And then when I got to medical school, I was really drawn to family medicine because I had some just wonderful experiences with family physicians in big cities and small towns and in other states and other countries even. So I was just really drawn to sort of the long-term connection with patients and how you're able to, we kind of describe family medicine as womb to tomb. So, you can take care of pregnant women, deliver the baby, take care of the baby, take care of I had some families where I was taking care of 5 generations of the same family. I really loved that aspect of it. And just the variety, being able to take care of kind of small issues when they come up, and then also chronic diseases and mental health care, being with families in kind of the most profound times of their lives. So that was kind of what got me into family medicine. And I also really liked procedures. So I liked being able to kind of mix in some procedures into my day as well.
That's awesome. And I love that you mentioned kind of the long-term relationship that you're building with patients with family medicine. I think that's what kind of owes to having the biggest difference with patients too, is when they can build that relationship with you. And so a lot of times, family medicine doctors are the first to realize when something's wrong because they have that kind of baseline of, how their patients are doing as well.
Absolutely. And, I think that was what inspired me. Some of the family medicine physicians that I worked with in medical school and residency, just that they had been taking care of some of their patients for decades and, knew the entire family, and they'd known this person and their family through thick and thin and through, many events that had happened in their lives. So yeah, I think when I went into medicine, like, I always liked science, but it wasn't really the science that drew me in. It was the stories. But I wanted to be able to engage with people and the stories of their lives in a way that was also meaningful and that could, that could make a difference, where if I could engage with their stories, but also affect their health, that was what I wanted to do.
I know you spent a long time working at the Cook County Health System, so huge safety net hospital in the
Mm-hmm.
whole US. And so I know you must have worked with patients from kind of all different walks of life, all different backgrounds. I'm wondering what lessons or insights have you taken away from that experience?
Oh, so many things. I working for Cook County was my first job right out of residency. I started with them because I had a commitment with the National Health Service Corps. So I had a commitment to work for 4 years in sort of an underserved part of the country or with an underserved population. And so I started off doing full scope family medicine there. So when we talk about full scope family medicine, that means, inpatient in the hospital, outpatient in the clinic. I did prenatal care and delivered babies for a long time in my practice, mental health care, physical health care. So I did that for a long time. And then I left for a couple of years and worked for another community health center while I was also doing a fellowship in community health. And I got a master's in public health as part of that. Because I think, after a number of years of working in that system, I kind of felt like I was, putting my finger in the dam of a lot of individual problems. I loved the one-on-one interactions with my patients, but I felt like the problems were so much bigger than I could address in a 15-minute health visit or many 15-minute health appointments. So, I wanted to get a public health perspective so that I could apply that to that patient population and to that health system. So when I went back and I did some, program design and program implementation, and then eventually went into administration, as well as, still providing patient care. So I started as the director of my clinic that I'd been working at for a long time, and then eventually became the director of primary care for the whole health system. So I guess, what I learned from that was not only, was I a provider for my patients, but I was also a provider for other healthcare providers. So I was taking care of doctors and nurses and, the work and supporting them in the work that they did, as well as the patients that we took care of. So, most of my work was in a clinic that served mainly an immigrant population from Mexico and Central and South America. Most of my patients, Spanish is their first language. So I learned a lot of cultural humility, wonderful stories and exchanges, just in terms of learning about other cultures and about approaches to healthcare and other beliefs, and working to provide support for health within those cultural contexts. I also learned a lot about the social determinants of health. Most of what supports health isn't what happens in the clinic. We can help to guide and direct that, but the social determinants of health include things like access to clean water and healthy food and clean air to breathe, access to good education and economic opportunities, literacy, how well can people read, understand numbers, understand what is being told to them in their visit. So those are some of the big things that I took away from that. But I think I also, in addition to recognizing sort of the huge challenges that our patients faced, just having good health and getting access to good health care, is that there were obviously some huge differences between how they were able to live their lives and my life. But I also found a lot of parallels. And, I think we all have challenges in how we're able to deal with our health. So, some of the same challenges that I found with my patients in terms of being able to exercise or eat healthy or maintain a healthy weight, for example, I also found, for myself and my own family and my colleagues, other doctors, we all face those same challenges. So those are some of the lessons that I took away from my time working there.
Yeah, you definitely touched on a lot of things. I think one thing that may not be immediately obvious is a full scope family doctor. So a lot of people don't associate family physicians as being able to also take care of people through the pregnancy and actually like caring for women's health as a whole. So that's awesome that you kind of got to practice full scope. I know it may depend on practice too.
Yeah, it absolutely depends on practice and sort of where geographically you're practicing, where you trained, and the healthcare system that you work in. So, I mean, I feel very fortunate that I was able to be trained in and practice full scope family medicine because that was kind of why I went into the field. But that's very often for a lot of different reasons. That's not always necessarily the case. So some people in some parts of the country, for example, really are not kind of allowed to do deliveries, for example, in the hospital, or, many health systems are now, have hospitalists. So you may have a family medicine doctor working as a hospitalist, and you may have a family medicine doctor working in the clinic, but not necessarily someone that takes care of you like through all of that. And, a lot of that just has to do with a lot of different things, reimbursement models and the way that our healthcare system is set up. So, but in, rural areas and small towns, for sure, you're more likely to encounter family physicians who are doing full scope family medicine. And also in some urban centers that are, maybe more underserved, like, again, kind of big, either community health centers or public health safety net systems as well.
It's also important to think about all of the social determinants of health, kind of like you said, with things like food insecurity, something that brings a patient to the hospital and then they get treatment for a certain thing, but they kind of go back to this way of living where they don't have access to certain resources. It might make them more likely to end up back in that same position they were in. So you can see how that might be frustrating for kind of like the healthcare system, but also the individual patients as well. I wanted to ask if patients are able to invest in a few habits that would really kind of set them up for success and have the biggest impact on their long-term health, what would you recommend?
Kind of in if you read research studies or do any kind of research into almost any kind of chronic disease or even like research into prevention, health habits, things like nutrition and exercise, not smoking, drinking in moderation if you drink, not misusing substances, like those come up, over and over again. So I think looking at that as sort of like a whole package is really important, as well as, things like sleep and prioritizing mental health and stress management, like all of that plays into it. I think, but all of that can feel really overwhelming as well, and I think, if you think about it for yourself in your own situation, or you're talking to a patient about it, saying, okay, well, there's like these 10 things you have to do. And, it can feel like a lot. So I think it's always helpful to break things down. I don't think, I don't think I could pick like sort of one healthy habit that I would pick for people, because it can be pretty individual. And really, I think it's the healthy habit that is most important to the person, and it's the thing that they might follow through on. One of the things we used to, one of the ways that we talk to patients about kind of setting health goals is by using SMART goals, which, a lot of times you'll hear about SMART goals now in like, business or organizations, things like that. But we use it quite a bit in healthcare as well, in terms of helping people to sort of set a goal and follow through with the goal. So, so SMART is an acronym in this particular case. So it stands for specific, measurable, attainable, realistic and trackable. So let's just take an example of, so one thing that we know benefits like almost every aspect of health is exercise. And we Americans in general don't get enough exercise for the most part. But let's say that you have, someone who's kind of, really doesn't do much, like they are in front of a computer all day, or, watch a lot of TV, don't really get a lot of physical activity. So you might say to them, or they might say, I want to exercise more. That is a great, big, overarching goal. But it's not a really great way to make change. So you have to break it down a little bit more than that. So let's say, okay, if you're kind of really not doing anything right now and you say you want to exercise more, so what's the specific part of the goal that you could make? And maybe it's, I'm going to walk 30 minutes 3 times a week. That's great. That's more specific. Can you get it down even more specific than that? So maybe, okay, take a look at your schedule, your work schedule, your other commitments. Like what's the specific time of day that would work for you? What are the days of the week that are better than others? Is there someone, do you have a neighbor or a friend, an exercise buddy that, you could walk with? So maybe you get it down to, okay, I'm going to walk 30 minutes at 10 o'clock, Monday, Wednesday, and Friday mornings with my neighbor, Kathy. That's much more of a specific goal. And then, when we get into the things that are like measurable. So, measurable, okay, you can measure, you can set a timer for 30 minutes. Attainable, it might not be so attainable to say like, I'm going to run a marathon next month. That might be a long-term goal, but it might be much more attainable to say, okay, I'm going to start by walking 30 minutes. Realistic, kind of goes along with that. And then trackable, can you keep track of it on a calendar or an app or some way just so you can plot your goals? So I guess I would say that. And then also, just being kind of generous with yourself and the people around you, understanding that it takes a while to create new habits. And you can always start again tomorrow. So I don't think that I would, pick a specific health habit in terms of content, but just more of a way of setting your goals and to set yourself up for success.
That makes sense. And, starting kind of like making these new goals is difficult. There's a lot that kind of goes into it. So if we're trying to start to eat healthy, for example, and we're kind of surrounded by other people that aren't doing that, or we're trying to like lose weight and it's not happening immediately, because these things, like a lot of things take time to kind of work. So how do you recommend that they still stick with that, even though they may not see those results immediately?
I think a couple of things. I mean, one is, that habits or the research into forming new habits or kind of getting rid of, quote unquote, bad habits, is that it takes at least 2 weeks to really kind of get something new ingrained as a habit. If you have started something new for a couple of days, suddenly you kind of fall off the wagon, as it were. That's actually to be expected. So, I try and encourage people to, recognize and understand that, that this isn't a personal failure on their part, that this is, it's something that takes time and we're going to start again. Another way is just to sort of, is to give yourself like little rewards to find ways of doing that. Talking with patients about quitting smoking, for example. Sometimes the health goals, the long-term health goals of like not having a heart attack or not getting lung cancer, those are big, important things, but sometimes it needs to be something a little bit more immediate. So if you can talk with people about like calculating how much they spend on cigarettes every week or every month, and then, okay, so let's say your goal right now is to cut down, by half. Okay, keep track of like how much money it is that you're saving, and then put that money into a special fund and think about something that you really want that you haven't been able to afford or haven't been able to do for yourself, and really use that money towards that. Even something like, we would have programs in the clinic sometimes with even just like stickers and things, which, kind of makes you think about like elementary school and, kind of getting a sticker for like learning your multiplication tables or something. But like, we're all kids at heart. Like people actually like got really motivated and happy about getting a sticker, kind of a literal gold star for their efforts. I think as much as you can, surrounding yourself with other people who are going to support you. So if you live in a household full of smokers, it's going to be more of a challenge to quit smoking, but to, kind of recognize that and to find a buddy, that is also has that goal, and to do it together with somebody. Those are just a few of the things that I think can help support you. Don't do it in a vacuum. You definitely need some social support when you're trying to make health changes for yourself.
That's super helpful. I love that we really got creative with all those ideas there. I wanted to ask about getting an annual physical. So do people need that every single year? Or is it okay to skip, do it every 2-3 years if someone's healthy? Sometimes everything seems fine on the outside and there may be things going on, so people may not know whether or not to go in. What's really the point of the physical?
So I think there are a couple of reasons for getting an annual physical. And to be clear and completely transparent, it's probably more important at certain stages of your life to really do it every year than maybe in other stages. So if you're a healthy, active 23-year-old, maybe not as important as if you're a 65-year-old who has some chronic health conditions, or if you're a 1-year-old who is in need of some regular preventative care. But with that said, even healthy, people who think they're healthy at 23, you could have things going on that you don't know about. And there's a lot of really great health information that you can get from your healthcare provider, your healthcare team, about ways to keep yourself healthy. There are probably some preventative things that you might not know about, like some vaccines that you're eligible for that could prevent some horrible chronic disease down the line. So I think it's always worthwhile to go in for your annual physical exam because you always learn something new. It's a way to help you kind of keep connected with your healthcare provider, with your primary care physician, and then you have that connection established. If you do get sick in the future or something else comes up. I think about the annual physical exam, sort of like taking your car in for routine maintenance. We're not, we're humans, we're not cars, obviously, but there are some parallels. So, you could have a beautiful sports car that has no rust, has this perfect finish, has all of the bells and whistles. It looks great on the outside, but there could be some stuff going on under the hood that you don't know about and that you wouldn't know about unless you go in for kind of your routine physical and have, a conversation with your primary care physician and your healthcare team, have a physical exam so they can check and make sure that, things look and sound and feel as they should. Do any kind of recommended blood tests or screening tests, or at least talk with you about the risks and benefits of having those things done. Provide or tell you where you can get vaccines, again, that could prevent things going down the line. And just to give you an opportunity to sort of talk at sort of a high level about what's going on with your health. If you do have a number of concerns at the time of your physical exam, if you have one or two, they might be able to be addressed at that physical exam. If you have a list, probably they can't all be done that day, but at least your healthcare provider can start to talk with you about them and also to help prioritize them and make a plan for how those things can be addressed.
I like the car analogy that you had a lot because it's true that a lot of these chronic diseases early on don't have the symptoms a lot of times. So it's going in and getting those labs and then maybe getting blood pressure taken and things like that can really help. Do you have any kind of other suggestions on what people should be thinking about, what they should be doing to really make the most of their appointments?
Yeah, I have quite a few thoughts on that, actually. One of the challenges, a really big challenge for both patients and doctors, is the fact that, for most healthcare appointments, we get maybe 15 minutes. Sometimes it's less than that. Some healthcare systems have 10-minute appointments slotted. If it's a full physical or kind of for something more complex, you might get half an hour. But kind of the average is around 15 minutes. So, there's only so much that can kind of be covered in that amount of time. What are, until our healthcare system is fixed, which, might take a while, what are some things that, you can do to be proactive with your health and to really make the most of your visit? One thing I'll always suggest to people is to make a list. Make a list of your concerns, write it down. If you come in with your full list, sometimes it can be a little overwhelming as a physician if, you see someone coming in with like a list of 20 things. So understand when you come in with your list that all of those 20 things are not going to be able to be addressed at that visit. Now, there's kind of two ways that you can go with that. Still bring in your list of 20 things, but you can either say to your physician, hey, these are all the things that I'm concerned about. I understand that we won't be able to take care of all of these today. So can you help me figure out the things on this list that we can talk about today, and then how we could go about talking about the other things at a future date? That's one way. The other, and probably the best way, is a combination of these two things, is to prioritize for yourself, like what's most important to you. If your right knee has been swollen and really hurting, and you can't sleep and you're limping around, that's probably going to be a little higher on your priority list than maybe a rash that you had 3 months ago and it really bothered you, but it's gotten better and it kind of comes and goes. And then things like your preventative care and health maintenance, they might be a little further down the list for you. They might be a little higher up on the list for your healthcare provider. So there may be a conversation where you kind of come to an in-between place on those things. But so making a list and prioritizing your concerns, I think, is really important. And those can be some of the things you might have on your list would be like, so any new concerns that you have, any new symptoms or concerns. If you have questions about your medications or you've been experiencing side effects from your medications, that would be another thing you would want to put on your list. If you've been to a specialist or you've been in the hospital or you had a test or a procedure done and you want to understand what the results were or what they mean, that'd be another thing to have on your list. If you have chronic conditions, like if you have diabetes or asthma, arthritis, kind of how have your symptoms been going, or, if you keep a log of your blood sugars or your peak flows, if you have asthma, bring those things in so that you can address those. And then, just questions and openness to finding out, like, okay, I turned 50 or something like that. Like, what are my, what do I need to have done? What are my, the health maintenance things I should be looking at. I think coming into the visit, that's probably the most important thing. And again, with the understanding that they won't, if you have a long list, they probably won't all be able to be addressed at that visit, but you can make a plan with your provider about how that can happen. If you're able to take notes, because it's really hard to remember everything that's said at a visit. So it'll help. It's helpful if you take notes for yourself. If you're comfortable bringing a family member or a friend, it can help to have, especially if you have something that is complex or that's hard to take in the information. So if you, for example, if you have like a new cancer diagnosis, it can be really hard to take in all of that information and sort of all of the specialists and tests that are needing to happen. So bringing in someone for support, but also just another set of ears to hear and be like, did you hear it the same way that I did? Someone that you can kind of bounce things off of. Bring all of your medications, bring in the actual pill bottles or at least a list of your medications and kind of be prepared to talk about how you take them so you can both be on the same page as to how you're taking your medications. And don't forget things like vitamins and herbs and supplements. Sometimes people think, well, those are natural products. I don't need to, tell my doctor about those, but they can have very real interactions with prescribed medications and they can give side effects. And so important to talk about all of those. Again, just simple things like bring your health insurance card or your Medicare card, a photo ID, your emergency contacts. And then, during the visit, make sure you ask questions, but not only ask questions, but kind of repeat back what you've heard. So let's say that you were prescribed a new medication and your doctor says, okay, you're going to take this new medication for your diabetes twice a day. So some questions you might ask might be, does it have to be so twice a day? Does it have to be like every 12 hours? Or can it be like just morning and evening? Do I take it with food? Do I take it on an empty stomach? What are some side effects that I need to watch out for? And then once you get the answers to your questions, just kind of, we call it talk back, so repeating it back, like saying, okay, what I hear you saying is I'm going to take this new medication with breakfast and with dinner. Some people, their stomach feels a little queasy for like the first couple of weeks when they're taking it. So that's something to watch out for, but that I might feel better if I take it with meals. Is that correct? And then that just helps to ensure that you're both on the same page. And then, ask your healthcare team for good quality sources of healthcare information. There's a lot of good health information out of there, and there's a lot of stuff that's really dicey and may actually not help to get you where you want to be with your health and may actually be bad for your health. So a good place to start is just by asking your healthcare provider for good sources of information, kind of become your own expert on your own health, but do it in a way where you and your physician and your healthcare team can work together. That's sort of my kind of down and dirty list of I think good ways to be prepared and to kind of be an advocate for yourself for your own healthcare.
Perfect. Yeah, that was amazing. There was kind of a lot in there. I think it's also helpful to kind of hear all of those different examples because they may not be things that we think about, but important to kind of bring those up and be aware of that. And then since you brought up sources of healthcare information, what are some good sources that you would recommend?
I don't know if I want to call out like kind of specific sources. They have sort of, because there's been some changes in kind of sources of healthcare information. One way to, one thing I would say is that, a lot of people will maybe start by getting their healthcare information with like a Google search, right? Which is fine. But I think whatever comes up on your search, look at the sources, okay? And if the sources are based in things that are research-based, so a lot of articles that you come across, and I'll use as an example. So I work a lot now in healthcare communication. I write a lot of articles for GoodRx for their health blog on a variety of different topics. And what they require and how we write those articles is by using very well sourced information. So we need to use research studies that are scientific, not just stuff that either comes from pharmaceutical companies or organizations or individuals that might have a specific agenda about things. So things that are really well researched. And then write the article at a very accessible literacy level. So we actually put the articles through literacy trackers and make sure that they're at a particular grade level so that the majority of people can read them and understand them. So I think asking your healthcare provider's office for good sources of information, if you're doing a Google search or any other kind of internet search, look to make sure that the article actually has like cited sources of information, which helps to make sure that it's scientifically based. And then if you're getting information from family and friends, which can be a good source of information, especially if people have like if you share a particular condition. So let's say that you're newly diagnosed with type 2 diabetes and your sister has type 2 diabetes. And she says, I got this really great information from my physician or from this diabetes group that I'm working with or from the American Diabetes Association. Like that's probably worth looking into. If it's from an individual, like, kind of a self-styled health guru or, anytime any health information that says like, this is the answer to your healthcare needs, you'll get a lot of those ads that pop up saying, like the only healthcare solution you need, or this is the answer to your diabetes or whatever it is. Almost always, it's not going to be the solution to your healthcare needs. So be a skeptic to a certain extent and look at a wide variety of sources and, really use your healthcare professionals as trusted sources of information, either to get information from them or to kind of to ask questions. Like if you've heard a certain thing, like, is it true that such and such cures diabetes? And then, they can help get you good sources of information from there.
So basically with social media, or like now it's just become easier to put your symptoms into AI, for example. So we kind of get the results of that, just being cautious about what's in there and then making sure that there's verified sources behind that.
Yeah.
If someone hasn't seen a family physician in a long time and they're trying to get established with someone new, what should they be looking for? Are there certain qualities that really stand out?
Yeah, I think that's a really important question, because like you said, it might be that you haven't seen a physician for a while, or it could be that you've moved, or your health insurance has changed, or you're just looking for something different in a physician. I think there are a few things to look for. I mean, one, just on a very basic level, is convenience. So is it somewhere close to your home if you drive? And maybe you have mobility issues, like is there a place to park? Is it an office that's an accessible office if you're in a wheelchair or use a walker? If you want telehealth as an option, I mean, there are some things that just cannot be addressed through telehealth. Sometimes you have to go in and, be examined or have blood drawn or tests done, whatever the case might be. But sometimes if you have a chronic condition and you're kind of doing follow-up on a regular basis, and maybe you have a work schedule that makes it very hard to, get in for appointments very frequently, and, you want telehealth to be part of the mix, then, you look for someone who offers that as part of their services. Obviously, healthcare coverage and cost. So if you have insurance, someone who is in your network or covered by your health insurance plan. If you some people will choose to go outside of their health insurance plan and see there's models of care called either direct primary care or concierge care, where you might pay a certain amount every month, and then you have greater access to your physician. So those are models that you can look at as well. For folks who maybe don't have health insurance, or who have Medicaid or Medicare, you might want to look at community health centers who will provide like a sliding scale fee for folks who are uninsured, or a public health system like a county public health system. Residency clinics are also options. So in those clinics, I mean, you're seen by a resident who is in training, but they're directly supervised by a qualified physician. And sometimes you can get even really exceptional care there, because you're kind of getting like care times two. You're the resident seeing you, and then, the attending's like looking over you as well. I think just, having a general understanding of different types of providers. So understanding the difference between a physician who will have either MD or DO behind their names, or primary care providers that are nurse practitioners will usually have NP behind their names, or physician assistants who will be PA, or some women's health providers are certified nurse midwives who have CNM. They can all be, really great providers, healthcare providers, but it depends on what your needs are and what you're looking for. And so it's just good to have an understanding of what their training is, how that differs, how they work as a team. And also within physicians, kind of what are the different specialties. So internal medicine are physicians who see only adults. Pediatricians see only kids up to 18 usually, sometimes a little bit beyond that. OB-GYNs do women's health and prenatal care. And then, family physicians are trained to do, again, full scope care. Some of them end up sort of specializing within that care. So some of them end up seeing only adults or only do outpatient. Some do women's health, some don't. So having that understanding, I think it helps to know about scope of practice. So again, do you only see people in the clinic? If I get sick, what happens? Will I, can I come to the clinic here? Are there telehealth options? Do I need to go to urgent care or the emergency room? Will I see you or will I see someone else in the practice? Just having a general idea of how that works. I think people have, they may have a particular preference for certainly a language preference. So if you primarily speak another language, you may want to have a provider that shares not just a language, but a culture. That isn't always possible. So you should know that you're legally entitled to an interpreter. So a lot of people think, well, I can bring my kid with me to interpret or my sister or whatever. In healthcare, you don't always want to use a family member as an interpreter, especially a kid. It's not a good idea. So you are legally entitled to have an interpreter. That might be someone who is in person or it might be over the phone, but that is something that you can have at every healthcare visit. You might have a preference for a particular age. Like some people want a little younger provider, someone who's, they consider to be more fresh or up on, the latest things. Some prefer somebody with a little bit more experience. You may prefer to have someone who's the same gender. If you have a chronic condition, what is the healthcare provider's familiarity with that, and do they treat it? So, if I have if you have rheumatoid arthritis, for example, have you treated patients with rheumatoid arthritis? Are you comfortable treating that? And if they're not, who would you be referred out to, and how would the primary care provider and the specialist communicate? And then just, I think, getting a feeling for, kind of their bedside manner. You can get a gut feeling in terms of communication, do they listen to you? Do they make eye contact? Did you have to, wait 2 hours to be seen? Or, were they fairly on time? All of those, kind of can make a difference in terms of how you choose a new primary care physician.
Sounds good. And again, just seems like a very kind of individualized, personalized decision based on what really matters to that specific person, for sure. Can we just talk a little bit about physician burnout and how that may affect patients?
Mm-hmm. I have done some research on physician burnout, so I can speak a little bit, I guess, first of all, as to what it is, before I talk about how it might affect patients. So physician burnout, or just burnout in general, it's a kind of a long-term stress reaction, specifically usually linked to work. And it kind of comes with 3 parts. The first part is emotional exhaustion. That usually comes first. So people just kind of feel like they're flagging. Maybe they were really enthusiastic about their profession when they first started, and they just find that they're having a harder time getting out of bed in the morning. They're kind of sitting in their car, before they go into work, okay, I can do this, giving this a little pep talks. The second aspect is depersonalization. So you don't feel like you have a harder time connecting with people. And so for physicians, that comes in as they might feel like they're less patient with their patients, or they're having a harder time being empathetic. And then the third one is sort of a decreased sense of personal accomplishment. You just sort of feel like, nothing I do matters, I'm really not achieving anything here. I'm just kind of running on the mouse wheel. So, burnout and physician burnout, it's something that it affects individuals, but it's really a health system problem. The research that's been done into physician burnout, and I should say it's very common. The surveys, the most recent surveys are about, I think it's about 40% of US physicians are experiencing at least some element of burnout. But what we know is that it comes from the healthcare system and the healthcare environment. So time pressure is a really big one. So like I said before, patients get frustrated because they're feeling like they're being like squeezed through the system. Physicians hate that too, and it's very frustrating and can lead to burnout. Kind of feeling like they have a lack of control over their work environment. So, a lot of times many health systems are corporations or are kind of beholden to insurance companies and reimbursement. So, physicians are kind of down the line in terms of like feeling like they have control over the way that they practice, like how many patients they see and how fast they see them and what medications they can provide, all of that. And then sort of the culture of the organization, like how much does the organization foster trust and transparency and respect? Like, do you still feel respected for being a physician and kind of the education level and experience level that you have? So, really kind of burnout boils down to sort of a mismatch, a values mismatch. So when there's a mismatch between the personal values that you hold and the work that you're being asked to do. So how that plays out in kind of patient care and in healthcare settings, if a physician is experiencing burnout, we know that there's a higher likelihood of medical errors. That's been documented that there's more errors that can happen if people are feeling burned out. You may sense a lack of connection with a physician who's, again, like exhausted or sort of feeling like they are having a hard time connecting because they're just having trouble getting through the day. Things can be missed, things can be overlooked. So, what I would say to patients, kind of going into a healthcare environment about physician burnout is just understanding that it exists and it's very common, kind of why it exists, that, if they're, going in and, upset that they don't have enough time for their visit, that's not their physician deciding that they're not important and that they don't want to give them the time. It's the amount of time that they've been given, and they also have 20 patients waiting behind them. So just understanding all of that and then advocating for yourself and your healthcare in sort of a respectful way and keeping that as an overarching perspective that there are challenges in our healthcare system. So, for instance, if you didn't have a question answered, kind of bringing those things up. If you feel like you weren't able to get through all of, the things on your list in the time that you had that day, just being aware that that can happen, but then making a plan with your healthcare provider for how to get those things addressed at the next visit.
Yeah, I'm sure a lot of the things that you already talked about, like kind of prioritizing the problems and then knowing that follow-up visits are available, things like that can really make a huge difference on the provider side of things too, and makes it more efficient.
Yeah, no, exactly. I think that that's, probably, again, like kind of the best thing that you can do in terms of, just sort of being organized and, getting your own priorities together and communicating with your healthcare provider that with the work that they do. And so then they can better help you with your healthcare needs.
Yeah. Then last question, if you could give somebody watching one piece of advice that would help them take better care of their health, what would it be?
I think, I think of health as like a tapestry or a weaving. Like it's not just one thing. So understanding that health, like true health, is our physical, mental, emotional, spiritual health, but it also includes our environment, our social connections, the way that kind of the structures are set up locally where we live, and also nationally and globally even. And then just understanding within that, we have we've had incredible advances, in the last decades and century, even in terms of vaccines and medications and procedures and surgeries. And, people have the potential to live longer and healthier than they ever did before. And your healthcare team can be a huge resource in helping you to live a long and healthy life. But also remembering that, the majority of your life is lived outside of the doctor's office. And so what you do in terms of your habits and choices and the things that you prioritize for your life are probably the bigger things that make a difference in terms of nutrition and exercise, and it's kind of how you connect with the world. But to make your health a priority and to use your physician and your healthcare team as a resource to help you get the resources and the all of the healthcare that you need and that you deserve.
Awesome. Yeah, I think my kind of biggest takeaway from kind of everything you shared was really like that we can be active partners in our health. Sometimes it feels like some things are kind of out of control. What we do kind of leading up to appointments and then kind of outside, how we take care of ourselves is really in our hands and we can make the best of it. So yeah, I just wanted to thank you again for taking the time to be with me and kind of sharing all of the experience and the advice that you shared today. So thank you so much.
Oh, thank you. It was wonderful to be with you.